Good morning, everyone. My name is Dr. Oluwatoyin Akambi. I did my medical training in College of Medicine, University of Lagos, and I worked at St. Emmanuel Hospital for about 2 years before I moved to the United States. I did an internal medicine residency and then did a fellowship subspecializing in nephrology and um, hypertension. So essentially kidney diseases and hypertension. Currently, I work in Brooklyn, and I'm in private practice. So continuing with our 50th anniversary health talks, today we will be talking about kidney health, how to protect your kidneys, how to protect your health in general. All right, so just a brief reminder of anatomy. Where are your kidneys? What do your kidneys do? So your kidneys are organs that are located on the two sides of your spine, in your lower back. So, people ask, they have pain somewhere else. Just specifically, the kidneys will be located on the two sides of your spine and your mid to lower back, below your rib cage. We won't go into too much of that anatomy on the screen right now. And so essentially, what do your kidneys do for you, right? You can think of the work of the kidney as filtration. On the screen, you see a water filter. And remember, what the water filter does is that you pour, the dirty water into the top of the filter. It cleans out, takes out all the waste, and then gives you the clean water at the end. So in this case, the urine will be what stays in the filter. This is a picture of nice, clear yellow colored urine. And what else do the kidneys do, right? Outside of the act of filtering, they're taking away all the waste products, they're taking away the excess water. So essentially everything you're drinking, everything you're eating goes through your body, it's metabolized, and eventually the good stuff is kept in by the kidneys, because that's what the kidneys do. They help you to keep the things that should be in the blood, and then the things that you don't need come out as urine. Outside of doing this very important thing, the kidneys are also involved in controlling your blood pressure. So, when you go to the doctor and you check, is your blood pressure elevated? Is your blood pressure too low? The kidneys are take a key role in that. We're going to talk about that a little bit more. The kidneys also help to produce red blood cells. There are certain hormones or things that are released by the kidneys that help your body to produce blood. All right, so you'll see sometimes people with kidney disease being very anemic. The kidneys also help to strengthen your bones. Bone health is one of the essential functions, actually, that the kidney will perform. Also electrolyte balance. So, when we talk about potassium, salt, sodium, things like that, the kidneys are very important to maintaining the appropriate balance of this. All right, so now just getting right into it, what are the things that we see that commonly would cause, kidney disease? Number one is hypertension. In Nigeria, this is actually in most of the world, hypertension would be the number one cause of kidney disease. And hypertension is something that we might have heard before. It's something we call a silent killer, right? Because you really don't have any symptoms per se, especially at the onset or at the early stages. Obviously, when it's pretty advanced, then you hear of people having things like strokes, but at that point, you've already had, you've already had damage to your system from the high blood pressure. The other things, and the very high number 2 on that list, is diabetes, which needs to be screened for. It's not always obviously apparent. High sugars, especially if this continues for a very long time, it doesn't even have to be that long. Especially uncontrolled high sugars is a very, very common cause of kidney disease. Number 3 right there is medications, right? So we talk about medications that are taken very commonly. It's not even like we're talking about some obscure medications. It could be medications that you buy, from the pharmacy. You just go to the pharmacy, hey, I have a headache. The pharmacy does not know you. They don't know your medical history. They're going to give you whatever medications they think are appropriate. Medications like something as simple as meloxicam, used in enough doses or a high enough strength for long enough, will cause kidney disease. Certain antibiotics can affect your kidneys. Um, One of the popular ones in our own setting will be things like agbo, herbal medications that you're not quite sure what has been put into it. It's also another common cause of, causing kidney disease. Then moving down the list, some people just have, a problem with their kidneys that they really cannot help. Some people have what we call autoimmune diseases. This is when your body is essentially attacking itself and specifically is attacking your kidneys. And lower down on the list, we have urinary tract problems. What I mean by urinary tract problems is like, for some reason, remember your kidneys are filtering and the urine is going from the kidneys, going down through your ureters and it goes into the bladder. The bladder is, when you have a full belly, that's where the urine is. So now it's the work of the bladder to excrete that urine. If for whatever reason there's any blockage at any point, just take your mind back to our picture at the beginning. If there is any blockage at any point in that tract and the urine is not coming out like it's supposed to, it backs up into the kidneys, and this is bad for the kidneys, right? And it's going to also cause some kidney damage, especially over a long period of time. In men, this will be more related to things like prostate issues, or in general, things like kidney stones would cause urinary tract problems. And now, assuming that there is something going on with the kidneys, what would you see? What would you look out for? Unfortunately, a lot of times it's nothing, right? You might not feel anything obvious that there's something wrong with your kidneys, especially in somebody who is younger and stronger, they might not see any signs. In some people, and also depending on how far gone the problem is, then you start to see people with, the swollen face, that puffy face. The legs could be swollen. The other signs are fairly, it's not like you will look and say, oh, this is the kidney problem. This is a kidney problem that is disturbing you, because it could just be like you're just feeling tired. You don't really feel like eating, no appetite. Um, you know, you feel like throwing up, the food tastes funny in your mouth. All those are also potentially signs of kidney disease. Sometimes you could see that the amount of urine that is being made has reduced, right? So you're peeing much less than you would expect given the amount of fluid you're drinking. In some people, it's something as simple as skin rashes, like abnormal skin rashes. And in some other people, you know, you might be peeing normal amounts or reduced amounts, but the urine doesn't look like the way it should, right? Remember the nice picture we showed with the yellow urine at the beginning? You'll see that in some people, not everyone, that, this is what happens. The urine just looks a little odd. So things that you could notice in the urine, the first picture just shows the color is normal, but notice how there's a lot of foam and there's a lot of bubbles in the urine. This is a problem because then we start to see potentially there's protein in the urine, and that is, a definite sign that there's something wrong going with the kidneys. The second one is a little bit more obvious. You could see that your urine is very dark. In this case, this urine is bloody, right? So you could definitely see this. Again, and some people, remember, you will still have that nice clear yellow urine that we saw at the beginning. So now, in terms of physical presentation, we have seen that, okay, there's something wrong with the kidneys. Maybe you're swollen, you have swollen legs, something. The next step, and really the only specific way that you can check for kidney disease, is by doing blood testing and urine testing. So here I put a sample of what a urine test and a blood test for kidney disease would look like. So this here is what we call a urinalysis. It's a simple test, very simple. It's done in the lab. You get the results in probably minutes, right? And what we're usually looking for is, well, obviously from a test, you really don't want to see any red values, right? In this case, you can see here, I'm just putting my pointer, there's protein in this urine. This urine also has some signs of infection, and the color is cloudy. But most importantly now, so now we know that there's something wrong with the urine. But most importantly, we go to the blood test. And we can see on the blood test, so I specifically chose an abnormal blood test. And there are two values that we look at when we're talking about the kidneys. One is for a number called the BUN and the creatinine. The BUN and the creatinine, all right, the electrolyte urea creatinine is what this test would be like in our Nigerian context. And what the creatinine is showing is how well your kidneys are cleaning your blood. The creatinine is very, very specific for the kidneys. The BUN could be high in other situations, but it's also, reflecting kidney disease. So when you start to see those two numbers, and when you do blood tests, just try to look at the blood test. You're not you're not a doctor, so you might not be able to especially identify the blood test. But if you see anything and you're reading it and they start to tell you this is high, you want to ask your doctor. You want to look at it yourself. And you also want to discuss with your doctor and say, what is the significance of these things that are high? So in this case, these two numbers being high show that the kidneys are not cleaning the blood like the way they're supposed to. Because if they were cleaning the blood like they're supposed to, these numbers should be on the lower end. All right, so in kidney disease with the blood test, the lower the better, the higher the worse. All the other electrolytes are also a little bit abnormal, but we'll just move on to, what. So now we've figured out that, this person, imagine this patient now has, feeling sick, having some nausea. They've done the blood testing, they've done the urine testing also, and everything is showing that there's a problem with the kidneys. So now the next step will be, obviously, why do they have the problem with the kidney, but also what stage of kidney disease do they have? If this is something that just happened, right? Maybe you took a certain medication and that medication is affecting your kidneys, then this is what we call acute kidney disease or acute renal failure or acute kidney injury, right? It means that something happened and, in a matter of days, weeks, months maybe, or not months, maybe 1 month, something happens to the kidneys and the kidneys are not working the way they're supposed to. Now, if this has been going on for more than, I would say, about 3 to 6 months, then we start to call this chronic kidney disease. So based on the blood test, we can see if it's stage 1 or stage 2. When the numbers change, we start to talk about stage 3. And that is progressive. When we start to talk about stage 5, then we have, a more serious problem on our hands, and we're starting to talk about needing dialysis. So what do we do? Right now, we know that this person has kidney disease. What's our next step? Obviously, if it's somebody who started a new medication, or, you went to the pharmacy and they gave you this medication that you started taking for back pain. You're taking meloxicam 4 times a day because you have back pain. And then you start to see these abnormal things. Obviously, the first thing is you stop that medication, right, that we think is the problem. And at this point, you've already gotten the blood test, right? So that means that you're already in the hospital at the very least. So you might need some fluids in some people to just help hydrate you. You might need some medications to make you pee out the fluid if you're retaining water, or, depending on what the specific problem is, then you want to treat that problem, right? If it's somebody who has something wrong with their kidneys, there's sometimes specific medications that they need. And at this point, this would be the realm of the kidney doctor. So now if we now say, okay, fine, your kidneys are abnormal, you have chronic kidney disease because this has been going on for more than 3 to 6 months, then what do we do? The first thing that you want to do is figure out, why did this happen, right? So if it's high blood pressure, you have to control the blood pressure. You have to, because as long as that blood pressure is high, the kidneys will continue to get worse. If the person has diabetes, they have to be on medications to strictly control the diabetes. Um, you have to make sure your numbers, your range for the diabetes is within normal levels. You have to stop any medications that will make the kidneys worse. And then there's certain medications sometimes that we would prescribe. Usually this again will be in the realm of the kidney doctor that would help to slow down the kidneys getting worse. Because at this point, if we say the person has chronic kidney disease, it means that the kidneys will not go back to normal, right? It means that at this point, the changes to the kidney has gone on for so long that what we're trying to do is manage the problem so that it doesn't get worse. So in some people, it will go ahead and get worse, and it is, again, it is not the end of the world. There are options for replacing the kidneys, and we call it kidney replacement therapy. And that will be in the form of dialysis. So these are just two pictures showing two types of dialysis. Again, dialysis is not something anybody prays for or wants. It is very costly. It takes up time. However, people with dialysis can still go ahead and function well. So this is a kind of dialysis that is called hemodialysis, and it's a cleaning of the blood, right? So the blood, you can see the two needles. One of the needles is taking blood from the body. This machine cleans the blood and then puts the clean blood back in the body. Unfortunately, your kidney works 24 hours a day, 7 days a week, right? So when you're doing this kind of dialysis, we have to find the most amount. You can't do it 24/7. So you have to find some kind of middle ground. So we usually do it 3 days a week, to kind of keep things at least somewhat stable. This other kind of dialysis is what we call peritoneal dialysis. And this is when you do dialysis through the belly, right? And essentially you put fluid in the belly. This is a catheter that connects inside. You put fluid in the belly, the fluid sits there, and after it has sat there, it starts to clean the blood. And then after a period of time, you drain the fluid back. And obviously you have to keep doing this, right? Because once you stop, if you get one treatment of dialysis, for example, the body is still forming its waste products because the body is still functioning. So, the waste will build up again. So this is a constant thing that you have to keep doing up until you get to the point of getting a kidney transplantation. This is what we call a gift of life, because essentially, this one person can give another person their kidney, because a human being can live on only one kidney, right? So one person will give another person their kidney, either somebody who is related to them. In the Nigerian context, we don't really have the deceased donor. Deceased donor is when, you're alive and you already decide before you're dead that, okay, if in the event that I die, I want to give away my kidneys to somebody who needs it. We haven't gotten to this point yet in Nigeria, but hopefully, at some point we'll get there. I think what we see more commonly is either a living related kidney transplant, meaning that maybe your brother, your sister, your mom, father's child also decides that, okay, I want to give you one of my kidneys so that you can stop dialysis, or a kidney transplant from somebody who is not related to you. So that's what we call the living unrelated kidney transplant. Obviously, this makes a huge difference because now you don't have to be on dialysis, indefinitely, but you do need medications to prevent your body from rejecting this kidney. So in a lot of cases, we could have prevented getting to this point, right, of needing dialysis, of needing kidney transplantation, if we had been able to prevent the original problem. So remember, taking care of your kidneys is actually not very difficult. In some people, unfortunately, even if you do the best, they have problems wrong with the kidneys that will make their kidneys fail. But in the vast majority, remember the two most common causes of kidney problems. Remember, number 1 was hypertension, number 2 was diabetes, number 3 was medications, right, that you should not have been taking willy-nilly. So make sure you're drinking enough amounts of water. You don't have to drink too much, you don't have to drink too little. Usually 2 liters of water or fluid, doesn't have to be just water, but preferably water in a day is fine. Don't take too much salt. So salt in the diet, which, a lot of our foods, you will go and eat, stew that has lots of salt. It's tasty. However, if you're doing this on a regular basis and not watching your diet, especially as age progresses, you need to be more conscious. This causes kidney failure in itself, but it also makes people hypertensive. And along the line, not everybody with hypertension develops chronic kidney disease, but you don't know who will, right? So it is definitely possible. Also, we already know the medications. I wrote what we call NSAIDs. In the Nigerian context, Feldene, meloxicam, celecoxib, medications like that we call non-steroidal medications. These are more names that you might not be familiar with. Ibuprofen, right, is fine. Usually for my patients, I tell them that they can take Panadol, acetaminophen, Tylenol. Those are usually safe on the kidneys. But remember, there's no medicine that doesn't have side effects, right? So even if you're taking the Tylenol, you should take that also with caution. Don't just take it because you feel like. But definitely the ones that will have the potential for damaging your kidney will be things like the Advil, Aleve, Motrin, things like that. We talked about controlling hypertension. See a doctor. Check your blood pressure. Hypertension is a silent killer. You might not feel anything. You might not even have headaches. But then you see someone and their blood pressure is so high, they've already had a stroke, their kidneys are already damaged. That's already a problem. Exercise and weight loss. But even if you exercise and you're not losing weight, that is still good, right? So just exercising enough that you raise your heart rate. It doesn't mean that you're running or you're going to the gym. It could just be you walking, doing a brisk walk, taking a brisk walk, walking around. You just want to walk around enough that your heart rate goes up a little bit. So I'm not talking about a leisurely stroll, right? You want to exercise enough that your heart rate increases a little bit. That shows that your exercise is actually effective. Just doing the exercise on a regular basis, even if you're not losing weight, is actually good enough to help with your health. So this is just I see many patients. This is just one of the stories unfortunately, that I have seen. This was a Black man in Brooklyn. He has no medical problems. He's in his 60s, but he has no medical problems because he hasn't seen a doctor. So if you don't go and see a doctor and they can identify the problem in your mind, you will feel that you have no medical problems. But he said, long time ago, he did one test. He wasn't sure which test, maybe urine, maybe blood. Somebody had told him that, there was something wrong with his kidneys, but nothing was bothering him. He felt fine. There was no swelling. He didn't have any headaches. So he just went ahead with his day-to-day life. Now he comes in, his legs are swollen, very swollen. They're swollen up to the knees. And then his EGFR. GFR is what we calculate based on, remember the labs we talked about, the creatinine that we talked about at the beginning. The GFR is what we eventually calculate. And remember the stages. When the GFR is less than 15%, then the kidneys are it's at stage 5, and the kidneys are essentially not working. So this patient eventually needed dialysis like immediately because the toxins had built up so much in his system that he wasn't going to survive it. And this story unfortunately did not have a happy ending. However, your story is starting here now. If you control the risk factors that you know about, right? Your kidneys are working hard for you. They're cleaning the blood. They're taking out the toxins. They're helping with your blood count. They're helping with your bone health. Remember all the things we talked about that I said the kidneys do for you. So don't fail your kidneys, right? Monitor your blood pressure. Go see your doctor. Do routine lab tests when you need to. It doesn't have to be, a whole barrage of tests, just basic blood tests. Check the urine, check the basic electrolytes, urea, creatinine, check your blood count, make sure those are, and you don't have to do this. I'm not saying go every month. If you do this once a year on an annual visit, you don't have to wait until you're sick before you go and check your blood test or go and see a doctor to check yourself. This is just something that really you should be ideally doing once a year. If you can do more, that's great, but that should be the bare minimum. Going to the doctor once a year, do your urine test, do your blood tests, try to eat healthy. We will still eat our regular foods, but don't make it excessive. Also try to have caution when you're seasoning. When you go out, do everything in moderation. Make sure you're drinking the fluids like you should. Make sure you try to have an active lifestyle. Again, your kidneys are working hard for you, so you should also work hard for them. Thank you very much. I hope that this has been helpful. And good morning again, and thank you for listening. Bye.